House Appropriations Chairman Jim Pitt says he hopes the House and Senate can get together, get a better piece of legislation concerning the budget than the House passed. Do you see that happening?
I do. I do. We've worked with the House. We've worked with Jim Pitts before. I think his comments were that he needed some help with the Senate to try and cover what our obligations are in our public schools.
Sure.
And that he was concerned about the fact that the House has a 34% cut in the Medicaid rates for nursing homes. And quite frankly, Chris, that would drive out, there would be no Medicaid provider that could provide a nursing home. And so we'd have a situation where 50 to 60,000 elderly people would be pushed out on the street. And I don't think that's the intent.
Right. Will the House budget pass in the Senate with the cuts that it has now, or what has to be done to kind of jockey and adjust that?
Well, I think each House looks at their role as being obviously independent.
Sure.
And obviously we're going to look at the House budget, but we've already been working on our own budget now for 3 months. So as we're going through this, we've already been going through all the articles. We've been going through both health care and the Medicaid part of the budget, and public education, higher education, our public safety. And so we've come up with our own judgments in the Senate on what are our priorities. Yeah. And we're going to fund our priorities. And I think you've got to keep in mind that you can cut public education, but unless you change the current law, you still owe that money.
Right.
And the same thing is true with Medicaid. Yeah. So I think we have to look at that carefully. And if necessary, in some cases, change current law, but make sure that we're providing the essential services that people want. But Chris, the main thing is, it doesn't make any difference whether it's the House budget, which with state and federal funds is going to cut about, what did staff tell me, about $25 billion, or it's a Senate budget, which will still cut a sizable amount of money. And I don't know what the federal dollars are, but from current spending, state dollars, not including federal dollars, I would think the Senate will be $7, $8, $9 billion below the current spending.
So that the Senate version puts money back into health and human services and education in the tune of, and again, we're talking approximate figures here, $10 billion. So the obvious question is where do we find that money? Where's it going to come from? And I know that's a loaded question, and if all of us had the answer, we wouldn't, the budget wouldn't be as hotly discussed as it is, but is it going to be tough finding that money?
Well, it's going to be tough because at the end of the day, we want to make sure that since government has no money, it's the people's money, that we're only funding those programs, Chris, that are really important. Yeah. We've gone through this exercise in 2003 when I came in, and then we went through it last year in 2010, and we're doing it again right now in 2011. And I think it's a healthy process when you go in and say, oh, does this program, not across the board cuts, but does this program within an agency have the same priority today as it did when we passed it? Yeah. And if the answer is no, then we need to cut back on our funding or eliminate our funding altogether.
Do you find that voters and constituents not just appreciate, but kind of expect that kind of specificity, that being that specific and looking directly at those programs as opposed to, like you mentioned, across the board?
I think so, because after all, at the end of the day, people expect certain things from government. And I think we ought to provide those things which they expect at a very high level of competence. And the things they don't want us involved in, then we shouldn't be funding those. And that's why we're putting a lot of emphasis in our public education programs, our higher education programs, health care, Medicaid, our public safety, transportation, things that people expect us to perform on.
Yeah. The three key words that we hear a lot of buzz about: rainy day fund. Will the Senate try to use all or part of it? And the governor's support plays a critical role in that. How do you see that?
Well, the governor's support has influence, a little bit more influence with some of the House members. Sure. In that we have in the Senate, 50% of my members are on Senate Finance. Right. And so I think they understand where we are. And the other 50% we're giving tutorials to on a weekly basis. In the House, they have 16%, 50%, 16%. We've got 3 times larger number as a percentage. and I don't know that they're doing the tutorials. So part of this is just information. And I think a lot of the House members are starting to understand that you can't necessarily eliminate certain programs that are important to a lot of people out there. For instance, in slashing Medicaid spending, if you reduce the Medicaid reimbursal rate on nursing homes by 34%, and most of your nursing home operators operate on a 4, 5, 6, 7, 8% pre-tax margin, everybody's going to be out of business. So what do you do with the 50 to 60,000 people, elderly people, that are in nursing home beds and covered under Medicaid? You're going to be pushing them out. Now, some may have families that can take care of them. There are few churches that might be able to take care of them, but by and large, most of these people either don't have family or their family works. Both, well, the husband, the wife, and so how do you take care of them? In public education, it's important that we not spend more than we need to, but we need to support our good teachers, and we need to make sure that we're funding our schools adequately. That's a requirement under the Texas Constitution. Now again, at the end of the day, even in the Senate, we're going to cut from current spending some $7, $8, $9 billion. And if you add in probably, that'll trigger about $10 billion or so federal funds. So we'll probably cut in total 15 to 19 to 18 billion dollars. But in a number of areas, we're going to be higher than the House because we've had more time to study it, more of our members have studied it. And again, we want to make sure that we're funding the essential items at an adequate rate, but not over that.
Yeah. As the leader of a lot of this that's going on right now, and a lot of the decision making that's going on, and a lot of the considerations that these lawmakers are taking under advisement. The Statesman article this morning says that, points out the fact 98 of the chamber's 101 Republicans are kind of betting on their constituents wanting cutting in state spending, wanting a reduction in taxes or no raising of taxes, no additional new taxes, and not so much minding or being able to live with, I guess I should say, cuts in education. A, two questions. Do you think that's accurate? And B, is that a safe gamble for some of these lawmakers?
I think that's probably an accurate opinion of some of the newer members.
Yeah.
But that's in essence what the Senate is going to do. We're just talking about degrees, Chris. In other words, I don't want my members to get hung up on, one house cut 12 billion, one house cut 9 billion. Let's not get hung up on that. As long as we're tightening the belt and we're reducing our spending and we're saving enough money in the rainy day fund so that we're not going to hit a cliff in 2013. With our current revenue growth, and our revenues are growing, we're going to be easily able to take care and balance our budget in 2013 without raising taxes, just like we're doing right now. So as long as we do that, then let's not get hung up on 8 billion cut versus 9 billion versus 12 billion. Let's fund adequately, because what I'm afraid of is after May 30th and over the next year and a half, if we don't do this right, you're going to have a tsunami in 2012, but it's going to be against the current members. All right. If we've got millions of parents that are upset because their kids aren't getting a good education, if we're pushing 50 to 60,000 elderly people out on the streets, hey, that's not a picture I want to see on your station on my watch.